I'm John DeMont, a columnist for the SaltWire Network. Recently, a student at St. Mary's University died from a suspected case of meningococcal meningitis. Now, the death of a young person is so painfully tragic anytime, but what makes it worse with meningitis is that sometimes those tragedies could be unnecessary. Some of the vaccines wear off with time, and one for meningitis B, you have to ask for so that your child will be vaccinated for it. We're joined today by Nori Matthews, a parent who knows this more than anyone. And we're also joined by Dr. Vivian Brown, a physician and vaccination expert in Ontario. They both feel that we are doing a poor job getting the word out about the availability of meningitis vaccines. There are 5 types of meningitis.
So hi, John. It's such a pleasure to be here. I'm a family doctor and in Toronto, and I do a lot of work with Immunize Canada, which is through Public Health Canada supporting advocacy and education around immunization. There are a number of different types of meningococcal meningitis. The common ones right now in Canada is meningitis B. Previously, the most common kind was meningitis C, but we do have vaccines in the public program for Men-C, as well as for a number of other kinds of meningitis, A, C, Y, and W135. That's referred to as a quadrivalent vaccine. So the bottom line is, yes, there's different types of meningitis, and we do have vaccines available for these types of meningitis. A number of them are in the public programs, but currently Men-B, which is the most common kind of meningitis that we're seeing both in babies and teenagers, although there is a vaccine, it's not in the public program in any province as of now.
So it means you have to ask for it.
The bottom line, and maybe Nori can go into this, is parents get told, we're giving you a shot to protect your child from meningitis. The average description of what's in that shot, whether it's A or C or the quadrivalent, never really reaches the parent. So parents think that their children are protected against meningitis, and indeed they're protected against some types of meningitis, but parents are not aware that they're not protected against Men-B unless they specifically ask for that vaccine or are educated around that vaccine. And that to me is the big problem. You know, you don't know what you don't know. And when you think your kid's protected, they are protected against some of the types of meningitis, but not the major type of meningitis that's predominant right now.
Yeah, and Nora, you found this out in the worst possible way. Could you just tell us a bit about that, if you would, please?
Yeah, absolutely. Well, I mean, I'm Kai's father, Kai Matthews. He passed away June 2021 from contracting meningitis B. He was a first-year student at Acadia. He was just back home from finishing his first year. It was springtime, and he was healthy, and he was the prime of his life. And he fell ill with a fever one night, and within 30 hours, meningitis B had taken his life. And we could not understand. We were blindsided. We like Dr. Brown said, we knew we had him vaccinated for meningitis when he was 12 in junior high, and we had never heard about the different strains of meningitis, particularly meningitis B. And, you know, to add upon what Dr. Brown said, you don't know what you don't know. You can't act on what you don't know. If we had known about meningitis B at any point of Kai, you know, getting ready to go off to university, and at that time, we would have vaccinated for him in a heartbeat. And I really believe, truly, honestly, 100% that Kai would be here today if we had known about meningitis B at that time. And I think a lot of parents, especially in light of the tragic circumstances with this new student who passed away a few weeks ago, you know, that really hit home to us, of course. And I can't believe another family is having to go through this in Nova Scotia under the same circumstances or similar circumstances. And it's tragic, and it's heartbreaking that this is back in the media again because of a tragedy. But it's encouraging also that it's providing an opportunity to clarify even more for parents about meningitis B and about the access and options you have for it as a parent.
Nora, you've been making an effort to make this this has become kind of a cause for you, right? Getting the word out. So can you just tell us a little bit about how's that going? Well, the student died at St. Mary's, I suppose. So that's.
After Kai passed away, we had a innate need to kind of try to make something sensible and positive come out of a tragedy like that in order to kind of move forward. There's no way we can comprehend ever how we could have lost Kai in that manner and at that age and that quickly. But one way that we have found a way to kind of move on in a form is to advocate for meningitis B for other parents and to help provide the awareness that we didn't have and the education that we didn't have so that this doesn't happen again. And here it has happened again. So that's the heartbreaking part of it. It's just, this shouldn't be happening in a country where we have access to vaccines and it's a preventable disease. It's with vaccinations, it protects you against these infections.
Yeah. And John, Nori's made a couple of really important points. Point one is that Kai was healthy. Yeah. This happens to healthy children. There is a higher risk if you have underlying disease, but when they go over the numbers, the most common reason to get meningitis is no reason. It happens sporadically to healthy people. So being in excellent health doesn't necessarily protect you. The other thing that Nori said is in 30 hours, he went from being a healthy young man to being deceased. It's a very quick onset disease, and that means you need circulating antibodies in your body to protect against this disease. Right. So immune memory, 3 to 5 days of immune memory to kick in if you were immunized a long time ago for something is not good enough. You need to
what's that mean, Dr. Brown? What's immune memory mean? That's a kind of lag, is it?
It's when your body recognizes something but takes time to get those antibodies up and running. And so with a disease, for example, like hepatitis, which we may immunize a baby, it has a long period before you actually get sick. So if you're exposed to hepatitis, it can take 14 to 21 days before you get sick. That's time for your immune system to kick in. With meningitis, you're sick within a couple of hours and you're dead within about 24 hours. Yeah. So there's no time for immune memory, which means you need to be vaccinated within the past 5 years. So when we look at students going to university, we know that first year university, living in residence, being on teams, sharing things, this is a high risk age group. These young people need to be immunized within 5 years of entering university. And that's an important age group to immunize adolescents. So as a family doctor in my practice, I'm focusing on this age group around 15, 16, 17 to get them immunized before they go to university. The other age group that is very much at risk are babies. And so we're immunizing babies at 2 months, 4 months, and so on.
So why isn't this just common practice? Why isn't it, mandatory that excuse me, for these age groups, infants, university kids, people of Kai's age, that it's not a mandatory situation? So
I can only explain it from the way I understand it. And meningitis is a rare disease. We get about 200 cases a year in Canada. Of those 200 cases, we don't have a high rate of a long time in hospital because unfortunately there's deaths and that happens quickly. Right. So when governments are looking at what is cost effective, how many days in hospital we're going to save, how many deaths we're going to save, it's a lot of money to set up a vaccination program when there's a small number of people that are affected. So it's not necessarily cost effective the way, for example, COVID vaccine was cost effective.
I see.
But for the individual family, as unfortunately Nori has lived with, it's a disaster. Yeah. And so my argument is that parents need to be educated about these options. Parents need to know about this. Parents need to be offered the option of getting their baby or their adolescent immunized because there's good immunization that's approved in Canada, on the market, and is recommended if you're high risk. And as I told you, you don't have to be high risk to get meningitis, or if you're in a lifestyle situation that puts you more at risk, which is early in university and a residence.
So why is, so we just, the word needs to get out, because I know, Nori, I know you. You're a smart guy and a good parent. You would have, of course, have done this. So it's just a question of having the will to get the word out, I guess. And if we're not going to immunize for everybody, if it's not cost effective from a sort of financial point of view, then surely we can get the word out.
And John, there's lots of things that we recommend that we don't pay, that government doesn't pay for. We won't let you take your baby home from the hospital unless the baby's in a car seat, but nobody hands you a car seat, right? You have to go out and buy that. Parents need to know that there are options to protect their children. They don't have to choose to take that option. That's an individual choice. But if they're not educated around the fact that the standard meningitis vaccines that we're using in the school system, both in Nova Scotia and in Ontario and across the country, do not include Men B, and parents don't know that.
And it isn't. Yeah. It isn't, Dr. Brown. It isn't different from province to province. Really, it's everywhere. This is the situation everywhere.
There's no Men B vaccine that's being given in the provincial schedule in any province. The timing of the quadrivalent vaccine and the Men C vaccine is slightly different in the different provinces. In Ontario, and I believe in Nova Scotia, we give infants at 1 year Men C, and then in grade 7 in school, we give the quadrivalent vaccine. And that's what Nova Scotia is doing. That's what Ontario is doing. And that's good. Those types of meningitis are not being seen anymore in Canada. We've done a good job immunizing, but what we have now is Men B, and we're not immunizing for that routinely.
Yeah.
And John, I have an analogy that is, I think every parent would be able to understand this analogy. When you have a teenager who gets their driver's license and they go out for driving the first time on their own, as a parent, you have an innate anxiety for that safety of that child. Yeah. And you would hope that they had their seatbelt on when they're out driving. And to me, the analogy is a vaccine is like a safety belt. It's there to protect you in case something were to happen. The chance of something happening is very minor, and when you go out for your first drive as a teenager. So is Men B. It's very rare. But to have that safety mechanism in place as a parent is the reassurance, and it's the individual choice to do that once you're educated and aware that there is an option for you.
Mm-hmm. Should universities be taking more of the lead more in this? I know, Nora, that you had some involvement with Acadia in people getting the meningitis B vaccine. Should this be just standard practice at universities, I wonder?
So we did a campaign at Acadia because that's where Kai was first-year student. Mm-hmm. Our connection to Acadia is very strong, and they were very supportive in helping us achieve a fundraising platform that we raised money for, and we had vaccine clinics at Acadia last year to vaccinate students who wanted the vaccine. To date, that program has vaccinated over 600 Acadia students with the Men B vaccine. Yeah. So, once the awareness is out there, the desire to protect students was evident, clearly. And, that model was a great example of showing what could be done, but it's not sustainable. It's very expensive to fundraise and to vaccinate that many students. Yeah. So what we've been able to do as an alternative is we've been able to have the university's student unions go to their administrators of their health plan. And in 4 cases, 4 universities have been able to revise their health plan to include meningitis B protection or coverage. That's Dalhousie has that now, NSCC has it, St. FX and Acadia, they all have that, made that change to their health plan. And we're hoping other universities will follow suit across Nova Scotia and hopefully throughout Canada to enable that access to the vaccine.
John, I think it's all hands on deck. We need the universities, we need the pharmacists, we need programs like this program. We need the education to get out there so that this starts to become a topic that people are aware of, because people are not aware of Men B. Yeah. And that's part of the problem.
So how in a as you say, it's all hands on deck. How can there be sort of an organic sort of program that gets everyone involved? Is there a move afoot in that direction, or is it we've sort of got a long way to go?
I think it's haphazard for the most part. I know that there's a fair number of family doctors that are very active around vaccine and talking to patients on a daily basis. And when you talk to a mother, and I'm saying a mother because it's usually I see the mothers with the baby about vaccine, they'll talk to their friends and they talk to their friends, and all of a sudden you'll get a call from another patient saying my kid hasn't been vaccinated. So I think that there's discussion about vaccine, but it's not in an organized way because it's not coming from public health.
I see. And is there political will? I mean, I imagine that's important, but it's just, I guess it's way on the back burner. I mean, Nora, have you in Nova Scotia, have you talked to, the Department of Health, the political people sort of in terms of your campaign?
I had an opportunity to talk to Premier Houston directly last year. I had a half an hour with him, and he was very, very receptive. He listened very well to my story about CHI and about the lack of awareness for meningitis B in the province. And unfortunately, things have not progressed further with support from the province. And I still think, and I said that at the time, there's an opportunity for Nova Scotia to be a leader in providing support for meningitis B. And that's the way it can happen. It's not going to happen top down federally. I think it takes one province to step up and say, look, we've had 2 tragic deaths of youth in the prime of their lives in this province. It's heartbreaking. It's rare, but it's happened twice in the past year and a half. There's something has to be done. And I think we're at the right place to do it right now. With the awareness comes the support. And, maybe that support is targeted towards university students, a subset of the demographic. I'm not sure, but something needs to be done. And I welcome the opportunity to talk to Premier Houston again in light of this recent tragedy and reinforce my desire to advance change and advance support.
Have you had any, by the way, any communication with the family of the young St. Mary's student?
We've reached out to them personally to express our grief, our shared grief, and we've only done that. We were giving them space. Obviously, I remember what it was like for us 2 weeks after we lost Kai, and it was a numb phase where we were just kind of trying to keep our head above water. And so I imagine that's the space that they're in right now. I offer my full support to them in any way to help them navigate the grief that we're navigating still and will for the rest of our lives. A part of us died when Kai passed away in June, and we'll never be the same again, and they won't either. And it's not a club you want to belong to, but at least we can support each other in knowing we're going through something that they're going through as well.
Certainly, Nori, Kai's story at the time, awful story, but it resonated across the country. There was, did you get, did people approach you, in other provinces and things like that, just kind of, obviously, to express condolences, but also to wonder what could be done in their province, or perhaps even having experienced the same thing elsewhere?
I've had numerous people reach out to me from across Canada, not only after Kai passed away, but recently we've been doing some national awareness campaigns to try to target parents as well as post-secondary students directly. And the stories and the comments we get back are heartwarming. People who are now made aware of meningitis B have vaccinated their children on the only incentive as just to knowing about it that we have helped them with the awareness of. That's really heartwarming. That's the positive outcome that makes us feel a little bit comforted that we're honoring Kai by trying to help people know about this and make a decision to vaccinate after they're made aware. So it's been incredible, the outpouring of support. And there's lots of people who want change to happen if they've had meningitis touch them in some way, directly or indirectly. Like Dr. Brown said, it shatters the family that it happens to, but it also shatters the community. The ripples of grief and loss go far beyond family into community, and that's where it's hard obviously as a parent who's lost a child, to comprehend this cost-benefit ratio, these decisions that are made because of the rarity of it. But I think it's a bit short-sighted, because the effect of something like this is far-reaching, and it's not measurable in a lot of ways that are in a cost-benefit ratio equation.
Yeah. What would Dr. Brown and Nori, both of you, I mean, if you'd like to see one thing happen in every province, but Nori particularly against Nova Scotia, what would it be? What would be that one thing that we need to have happen right now, which would, is it just as simple as just a communication campaign, for example, that would, a broad-based communication campaign? Would that be a great starting point? Or
I think that would be a great starting point. What Dr. Brown is doing is essential to talk to her patients at those touch points that are so important to get the conversation going. But I would like to see consistency in messaging coming out from public health. When the stories were in the media after the tragic death of this new student, my frustration was such that the messaging was unbalanced, and the context was not there. And it almost felt like the messaging was to support the public health department instead of the health of the public. It felt very one-sided, and it wasn't providing the information that parents need to know about access to the meningitis vaccine, that it's there. Once you know about it, you can make an informed decision to protect yourself or your children. And that's being proactive. Yes. I think that the overall response that is provided when these things happen is a reactionary response. Vaccinate people that were affected, close contacts of the person who contracted, and that's what you do. But there's no proactive actions happening, and so the awareness, the balanced and consistent and transparent awareness about meningitis B across Canada would be the very first step to making this situation much, much better.
Yeah, I totally agree. I think parents need to know, when we say your kid had a meningitis vaccine, that it did not include Men B. Parents need to know that Men B is a separate vaccine. Parents need to know that Men B is the most common kind of meningitis right now. So I think that awareness and fair communication is most important. In the long run, what I would like to see is that Men B gets put into the standard schedule in every province and territory, like it is in the UK and Australia and some other countries, because it is a devastating disease. And I think realistically, if we can't do it immediately, at least we should be communicating so that parents have options.
Yeah, good, great. By the way, how have you, in terms of, and I'm not suggesting that this should be your job, but kind of building a network of physicians that are doing what you're doing, telling patients and telling parents of young children and older children of the importance of getting this vaccine. I mean, is there sort of a move afoot in that direction, would you say?
Well, I do a lot of teaching on vaccine to doctors and healthcare workers, pharmacists, nurses, those people that have the option to talk to patients. And so Men B is one of the things that we talk about as we try to help providers understand, communicate, and initiate a vaccination for multiple vaccines, Men B being one of them. So I do a lot of work with Immunize Canada and various other groups across the country.
I mean, and I'll ask, and I'll close with this. I mean, it's very sad that it's not, we're not vaccinating for it. Is it, and as you both said, the cost, the cost benefit, kind of analysis that seems to be going on. Is it frustrating? Is it mystifying? I mean, how would you describe this whole debate? The mere fact that you're having this debate, must be, agonizing for you, Nori.
The problem is, John, is that the public thinks if it was important, it would be in the schedule. It would be provided by the province. And what we know and what we understand is that the province can't possibly provide everything. And so because something is not in the public schedule does not mean it's not important. And I would like public health to be teaching about this, even if they're not providing the vaccine. So it's communication first and access second.
Yep.
I exactly agree. Yes. If the discussion has to be there regardless of whether there's a schedule for it in public health. It's got to be talked about.